Sorry, my mic was mute. Welcome everyone. So sorry for the distortion. So this whole mechanism thing is GS. Okay, where is my red color? So this whole mechanism thing is the GS thing. If you please excuse me for 1 second, I wanna text it in the group that the link is same. Okay, let's move it further. So I guess you understand this whole mechanism for the stimulatory responses. Okay, now you see when I'm talking about clear all drawings. Okay, when I'm talking about this, I was telling you about this. So you see, beta 1 and beta 2 have this stimulatory second messenger responses. Similarly, when I talk about D1, we have GS. Okay, and all the muscarinic from M1 to M5 also have GS. So remember this GS with these receptors. You have to learn them. Okay, beta 1, beta 2, D1 and M1 to M5 all GS. Okay, now let's move to the other mechanism, which is GI. Okay, now this mechanism is GI, and you see this is acetylcholine. Okay, this is acetylcholine. I have just given an example of acetylcholine. Okay, it can be in case of acetylcholine, this should not be alpha 2. Okay, this is wrong. When we are talking about acetylcholine, this is a muscarinic receptor. Okay, and which muscarinic receptor? That thing I just told you, that in case of I, we have this M3. Okay, we have this, so this should be M2 or M4. Okay, but for example, just take this piece over here, and this is the receptor again, and then this is 1 2 3 4 5 6 7. Okay, and this. Okay, so now this is here epi, so this receptor will be alpha. Okay, now it can be alpha or beta. Okay, it can be alpha, it cannot be beta, it is alpha. Okay, because beta 1 and beta 2 are GS. Okay, if you remember, you see, sorry about this, image is going with us. Alpha 1 and alpha 2 is GS. Okay, and you see, we were studying about GI, so it is alpha 2. So this epinephrine, and this is GI, so this is alpha 2. Okay, so wait a second, let me go and fix it here back again. Okay, so now you get it. We are studying GI, and epinephrine has alpha 2 and acetylcholine has M2 M4 at this particular level. So you can kind of write it in your notes, and I will change it, change the mistake from here. Again, the same mechanism will happen. When the neurotransmitter is not attached, this receptor is empty, you have GDP attached at this level. Okay, but when this receptor has the neurotransmitter, be it acetylcholine or be it epinephrine, okay, then what happen, this GDP, it is not GDP, it is GTP. Okay, it is GTP in this case. So what happens is, when GDP is attached to this alpha I subunit, it will again dissociate it from here, and it will be left like this. And because it is inhibitory, it will show all opposite effects to GS, because GS was stimulatory. And do you remember in pharmacology lecture, we have kind of studied the all the stimulatory effects, okay, that everything is contracting. The overall function was contraction and constriction, that's stimulatory effect, and the increase, all arrows were going up, okay. So here in this case, all the effects will be opposite, that is everything will be inhibiting. Clear? Let me take you to a bit of revision to this. See, inhibition of norepinephrine release. I have explained you this diagram. Decrease acetylcholine release, decrease insulin release. Everything is decreasing. We are seeing decreased lipolysis. So all the actions are inhibitory. Okay, in case of alpha 2. So alpha 2 basically works on the principle of GI. Clear? Then when we were talking about this alpha 1, okay, we have still not studied this. Alpha 1 works on the principle of GQ, okay. So GQ mechanism is remaining. So just keep in mind that it has this function of constriction and contraction, okay. So let's move to GQ. And what about beta 1, beta 2? Beta 1, beta 2 works on the principle of GS, okay, GS. So you have to remember two words with GS, that is adenylyl cyclase and protein kinase. You have to remember these two things, okay. Now let's move to, okay, you see this is also the same picture which I was like kind of showing you now in pharmacology today. This is also the same picture, that this receptor in the presynaptic is alpha 2, and when norepinephrine is too much over here, it also goes over there and it gives the signal, the messages that do not produce more norepinephrine, we don't want it anymore. So okay, so this is the same picture. These pictures are from Lippincott, okay. So now this is GQ. So GQ works on the principle of DAG and IP3, that is inositol triphosphate and diacylglycerol. Now they have separate functions, okay. I will tell you that they have separate functions. Now how it works, let's see down. Okay, now here we are with GQ. Okay, now you see again, when it is alpha 1, the neurotransmitter will be epinephrine, okay, but it can also be acetylcholine. Take this as ACH, AC and H. So what will be the name of this receptor if it is working on GQ principle and acetylcholine is attached? So the receptors must be M1, M3 and M5. I just told you these things, okay? I told you to write it. So keep these things in mind. When we're talking about GQ and the neurotransmitter is epi, the receptor is alpha 1. When we're talking about GQ, the neurotransmitter is acetylcholine, the receptors are M1, M3, M5. Okay, now again, this is a G-coupled protein receptor, the 7-pass or the serpentine receptor we call it. And again, the same system is here. You have this 3 subunits, alpha, beta, and gamma. And when this whole thing is empty, we do not have a neurotransmitter attached at this particular level. With this alpha q, GDP is attached. Okay, with this alpha q, GDP is attached. Okay, when it is empty. But when a neurotransmitter comes and attached to this receptor, like this acetylcholine, or like this epinephrine, this GDP is no more. It goes away and GDP comes and attached to this alpha q. And what GDP will do? Again, the same thing. It will dissociate and dislodge this 3 subunits, and alpha q will only be left behind, and now this alpha q will activate this phospholipase C. So here in GQ mechanism, you have to remember this word, phospholipase C, just as you remembered in GS, adenylyl cyclase. Similarly, here we have phospholipase C. And what does phospholipase C will do? It will activate DAG, that is we call diacylglycerol, okay, and IP3, that is we call inositol. Tri means 3, inositol triphosphate, okay. So these are the things that is written in your textbook in front of these S, I, and Q. So okay, so you have to kind of remember these things. Now what else is going on over here is, you see what IP3 is doing and what DAG is doing. Okay, so you have to keep in mind that IP3 will be, it is not too much involved in protein phosphorylation. It is more involved in increasing calcium from the endoplasmic or sarcoplasmic reticulum. Okay, the calcium stored in the sarcoplasmic reticulum is pushed out to make the contraction and to and for further activity at the postganglionic end. So you have to make sure that you understand the function of IP3. IP3 will increase calcium from the sarcoplasmic reticulum. Okay, there is this substance called calcium calmodulin. It is activated and then this mechanism happens. Okay, so that is basically a detailed lecture on cell physiology, so we will be covering that in there, but for here you have to remember these correlations. Then when I talk about this DAG, that is diacylglycerol, it is involved in the phosphorylation of cellular enzymes, and one of the cellular enzyme is protein kinase C. Do not confuse protein kinase A with protein kinase C. I will show you this. This is all messy. I will show you this again. In case of GS, we have protein kinase A. This is A, okay? So protein kinase A is activated by this mechanism. But protein kinase C is activated by the GQ mechanism. Okay, so it phosphorylates the cellular enzyme protein kinase C. Also, it will increase the influx of extracellular calcium. Okay, and what extracellular calcium will do? It will activate the contractile elements, okay, in the smooth muscles. The contractile elements present in the smooth muscles, not skeletal muscles, smooth muscles, okay? Smooth muscles. Smooth muscles also needs to constrict. They also constrict. So for their contraction, for their constriction, this calcium is important. So this is all about GQ mechanism. Now we will go back to the book okay, and see if this all is right. What we have down. I have written the same thing over here. Okay, the cholinergic receptors, which we also call cholinoceptors, and you remember adrenergic were called mechanoceptors. So adrenergic were called mechanoceptors, cholinergic were called cholinoceptors. So I told you in pharmacology today. So M1, M2, M3, as I told you. Okay, this is like directly from the book. Then we have this um, excitatory, inhibitory, and what we can say, both GQ are excitatory, and then this is inhibitory, GI. And I told you that the parasympathetic one is this works on the nodes. So you remember not only SA, but we also have AV in here. Okay, so there is always a variation in every book, so don't worry. When we talk about nicotinic, then I told you we have this NN, NM, and NN receptor again. So this NN is not only present on adrenal medulla, but all the autonomic ganglia. But NM is present on the neuromuscular junction, okay, the skeletal muscles, okay, and they are excitatory. All the nicotinic receptors work on the principle of sodium-potassium exchange, okay. Sodium goes out and potassium comes in. Okay, sodium goes out and potassium comes in. Also remember, there are always 2 sodium going out, okay, and there are 3 potassium coming in. This is a rule. So if you don't know, you can like mark it. So let's go back to the book now. This was all about the receptors and the neurotransmitters. Now you see what book has to offer us. In case of these adrenergic, okay, now up till now you might have learned it by heart that these beta 2 is using this GS thing, okay, and alpha 1 is GQ, okay, and alpha 2 is GI. And then you see the mechanisms that GS were activating adenylyl cyclase. Okay, and what adenylyl cyclase was doing, adenylyl cyclase was converting ATP into cyclic AMP. This ATP was being converted to cyclic AMP, and then the cyclic AMP was in return activating protein kinase A. Okay, and then we were responsible for the phosphorylation, the depolarization mechanism. This was how it was working. Okay, when I was talking about this alpha 2, the GI, the G inhibitory, we were seeing the decrease in cyclic AMP. Now what is the mechanism when cyclic AMP will be decreased? You will see there is more and more potassium going inside the cell. Okay, there is more and more potassium going inside the cell. Potassium is responsible for repolarization, and when if you remember the action potential, this is depolarization. It reaches to a specific threshold point, and then we have a depolarization, and then potassium comes in at this particular level, and we see this repolarization. And then if more and more potassium comes in at this particular level, we see it going below, and that we call as hyperpolarization. So when more and more potassium will enter into the cell, it will cause the cell to inhibit bad. This is what we call hyperpolarization. Okay, so remember this point. Then when I talk about alpha 1, you see it works on the principle of GQ, and the mechanism is IP3 calcium. Okay, IP3 DAG, and then this DAG They have not written DAG over here, okay? IP3 and DAG, and then this DAG will activate protein kinase C. So for the purpose of your exams, you know, you don't have to remember or learn everything. When you once understand it, you will never forget it. So this is how it works. So I think you're much clear with the locations, the G proteins, and the mechanism. Okay, now let's see what cholinergic has to offer. Now these are the neuromuscular receptors present at the skeletal muscles, and they do not work on the principle of G protein. Why? Because this is not autonomic. This is somatic nervous system. Okay, this is somatic nervous system. And they work on the principle by opening sodium and potassium channels. Okay, sodium will go in, potassium will go out, so the cell will depolarize. When sodium will come inside, the cell will depolarize. Sodium will come in, potassium will go out. Both are positive charges, so that is why they have to balance each other. If both of them will come in, it will cause hyperdepolarization. So we don't want that. We want a balance. So, you know, we are letting 3 ions of sodium in and 2 ions of potassium out. Okay. Then in this nicotinic receptor, which are present at the autonomic ganglia level, we see this again, the same mechanism. Okay. And there are no G protein at the level of ganglia again. So you have to remember this point. Then we are at the muscarinic ones. So in muscarinic, you see what is going on. In muscarinic, you see I told you every book, you know, every book is has different things written. So you kind of have to write it down. The things that I've told you were from BRS pharmacology. Okay, so they have only mentioned a few of them. So you can like kind of write it and add in here. That was from BRS pharmacology. But again, you see the same mechanisms with QIP3 DAG calcium, and with GI decrease cyclic AMP, that is increase potassium into the cell, causing it to repolarize. Inhibitory mechanism. Okay, I think you people are clear till now. If you still have problem, you can ask me in private. Then we have these receptor types in the autonomic nervous system. Okay, it is already 8, but I'll like kind of I have already taught you this all, so we will just go quickly with these lines. Okay, so that we may finish this this page. Okay, then the next thing for tomorrow's lecture will be the main physiology of this. Neurophysiology will start from this brainstem, hypothalamus, and there's a lot of explanation at this little part. So that I will not take this little part today. We will move it tomorrow, and then we will be having sensory systems. Okay, so for today I will only read this little portions because I've already explained you from my notes. So we still have time left. Okay, it's been 24 minutes to this recording. Okay, so let's give it a quick read. Adrenergic receptors, which are also called adrenoceptors or mechanoceptors, okay, this alpha 1, are located on vascular smooth muscles of the skin and splanchnic regions, the gastrointestinal and bladder sphincters, and the radial muscle of the iris. So my notes were basically from this book. Okay, those notes which I showed you in today's pharmacology lecture, I showed you these notes. We have studied these pages, so that's why I'm giving it a quick read. Okay, so this all is made up from this BRS physiology. They produce excitation, okay, because they work on the principle of GQ, and the overall function is contraction and constriction. So remember this line is really important. You have to remember the location of these. Okay, are equally sensitive to norepinephrine and epinephrine. However, only norepinephrine released from adrenergic neurons is present in high enough concentration, 80%. okay, 80% to activate alpha-1 receptors. So this is the point you need to remember, that nor-epi is in more concentration than epi. Okay, then the mechanism of action is GQ. I told you, stimulation of phospholipase C. We just have seen the mechanism that GQ activates phospholipase C. This phospholipase C will activate IP3 and DAG. Okay, and then we will see this intracellular calcium influx from the sarcoplasmic reticulum, okay, causing it to contraction and constriction. Clear? Alpha 2 are located, locations are very important, on sympathetic postganglionic nerve terminals. Okay, again, this same little, where it has gone, the same little thing, you see, alpha 2 receptors, which are inhibitory. So they are present at the sympathetic postganglionic nerve terminals, platelets, fat cells, and the walls of GI tract. So I have explained you all these things, okay? Often produce inhibition, that is, they causes relaxation and dilatation, and the mechanism of action is GI protein, okay? Alpha 2 works in the principle of G inhibitory. So it will inhibit the opposite effects of GS, okay? It will inhibit adenylate cyclase, and adenyl cyclase will not convert ATP into cyclic AMP. So there will be a decrease in cyclic AMP, okay? And then the cyclic AMP will further not activate protein kinase A. When protein kinase A will not be activated, we will see dephosphorylation, okay? Dephosphorylation. So all the effects are inhibiting here. Then we have beta 1 receptors, which are located in sinoatrial node. Okay, important. Atrioventricular node, important. And ventricular muscles of the heart, very important. Remember these things. These are very important points. Okay, because heart is very complex. If you will not remember it at this particular level, you will find it really hard in understanding cardiophysiology. That is why I chose neurophysiology to teach you first, because it has a lot to offer for biochem, for pharma, for anatomy. So that is why this is very important. Produce excitation. Okay, beta 1 are excitatory. They works on the principles of GS, that is G stimulatory. Okay, increase heart rate, inotropic effect. Okay, sorry, chronotropic effect, increased conduction velocity. Whenever velocity word is coming, we are talking about dromotropic, positive dromotropic effect, and increased contractility, that is positive inotropic effect. Remember, I told you in the morning for in pharmacology lecture that you do not have to let C and C meet. So C goes with I, okay? So increased contractility is positive inotropic, increased conduction velocity is positive dromotropic, and increased heart rate is positive chronotropic effect, okay? Then they are sensitive to both norepinephrine and epinephrine, and are more sensitive than alpha-1 receptors. Now this is important. If a part has both alpha-1 and beta-1, so beta-1 will work more than alpha-1. So they are more sensitive. Mechanism of action is GS, stimulation of adenylate cyclase. What adenylate cyclase will do? Convert ATP into cyclic AMP. So we will see an increase in cyclic AMP. This cyclic AMP will activate protein kinase A. Okay, activation of protein kinase A, and then this protein kinase A will cause phosphorylation. Then we have beta 2. Okay, we will be continuing our lecture for next 10 minutes only. Beta 2 receptors are located on vascular smooth muscles of skeletal muscles, okay? The means that the blood vessels of skeletal muscles, okay? Bronchial smooth muscles, wall of GI tract, and bladder, that is the detrusor muscle, produces relaxation, dilatation of vascular smooth muscles, dilatation of bronchioles, relaxation of the bladder wall. I told you this is very important to understand the mechanism of relaxation of bladder wall. Whenever bladder wall is relaxed, the sphincters will be constricted. The sphincters have alpha 1 receptors and the detrusor muscle have beta 2 receptors. So both of them, alpha 1 and beta 2, work together, okay, to retain your urine, okay, for the urinary retention. And then this beta 2 are more sensitive to epinephrine than to norepinephrine, so you have to remember this point, are more sensitive to epinephrine than the alpha 1, okay. And mechanism of action is same for beta 1, that is, it works also on the principle of GS. So this is how we roll. Then you have this cholinergic receptors, which are called cholinereceptors, okay. They are located in autonomic ganglia of the sympathetic and parasympathetic nervous system at the neuromuscular junction, that is the skeletal muscles, and in the adrenal medulla, that is NN. So these are the locations, okay. I have shown you in the picture already. The receptors at these locations are similar but not identical and are activated by acetylcholine or nicotine, okay. So nicotine, it is because of nicotine we call them nicotinic, but in human body we have acetylcholine as a neurotransmitter that is working on it, okay. So you have to kind of remember these things. So the location is very important, people forget this, so you have to remember these locations, okay. They are excitatory, okay, and are blocked by ganglionic blockers for hexamethonium. Do not worry, we will be studying these drugs thing tomorrow, okay. So just keep that thing in mind. Mechanism of action is acetylcholine binds to alpha subunits of the nicotinic acetylcholine receptors. The nicotinic acetylcholine receptors are also ion channels for sodium and potassium. We have studied this particular little thing in this chart. This chart was like the whole story of what we are reading right now, okay. This point, this point, they work on the principle of sodium potassium channels, okay. So this chart is the story of what we are reading right now, the summary. Then we have this muscarinic receptors, which are located in the heart, smooth muscles, and glands, okay. They are inhibitory in the heart. Very important thing, very important thing. The heart excitatory functions are adrenergic, but the heart inhibitory functions are muscarinic. You have to, this is very important point, okay. So they will decrease the heart rate, that is negative chronotropic effect, decrease conduction velocity, negative dromotropic effect in AV node. Also they decrease the contractility as well, okay. Are excitatory and smooth muscles. You see opposite functions. At one end it is inhibitory, and the other end it is excitatory. So they are causing the GI motility to increase, okay, and they are causing more and more secretion from the endocrine glands. So these 2 points are very important to remember regarding muscarinic receptors, okay. They are activated by acetylcholine and muscarine, so named muscarinic, and are blocked by atropine. So do not forget the antidote. This is the antidote, okay, of acetylcholine, atropine. So we will be studying this tomorrow. So don't hustle. I will not go in detail right now. Okay, this is physiology class. Then mechanism of action, heart essay note per we have GI, okay. Inhibition of that is how they are like decreasing this all things, okay. So this is the mechanism of action. Inhibition of adenylate cyclase, which is leading to opening of potassium channels, as I told you, causing repolarization, slowing of rate of spontaneous phase 4. We have, you know, heart has this kind of action potential. This is phase 4, This is phase 3. This little thing is phase 2, and this is phase 1, and then below it we have phase 0. This is hard suction potential. So it, at this particular level, potassium channel opens and potassium gets into the cell, which causes it to depolarize. So this is phase 4 depolarization. Okay, it decreases the heart rate by this action. Then we have smooth muscle and glands, which works on GQ protein principle. That is, phospholipase C will be stimulated, increase IP3, DAG, increase intracellular calcium. Okay, increase protein kinase C activity. So this everything I have explained you. So we are just giving it a read so that you may get satisfied, nothing is left behind. Now, these are the drugs that act on the autonomic nervous system. I will skip this part from physiology. We are going to study this part in pharmacology tomorrow. Okay, tomorrow class will be on these drugs. So I'm skipping this part. No time, nothing to waste. Time is very precious. Then we have this chart on effects of autonomic nervous system in the organ systems, and we have discussed all of them today in pharma class and just now. Okay, it is all given in these notes. We have gone through these little things just now. Okay, so the functions are already there, the location is already there, so we have just gone through this everything. So if you want to go through it, kind of check it again one more time. So here I will be ending at this particular level. I will be ending, we have studied this D. Okay, this is the chart. So at this particular level, at this D, I am ending today's lecture, and we will be continuing autonomic center tomorrow, because we have left with like 2 minutes more. So I will not continue this. This seems little, but there is a lot to explain here. So it will be taking at least half an hour. Okay. So up till here, today's neurophysiology lecture 2 is finished, people. We will be meeting tomorrow, okay, with neurophysiology. Today one class is left, that is biochemistry, and we have to kind of go through yesterday we studied vitamin A. Today we have to study vitamin B1, B2, B3. Okay, so I will be delivering that lecture after 9 o'clock. Okay, or maybe at 8:45. It is 8:19 p.m. right now, and I'm kind of tired. So I will be delivering that lecture at 8:45. Okay, so if you want to join it live, more than welcome. If not, no problem. I will upload all the recordings at night, okay, as I will be done with today's lectures. And in upcoming weeks, I will be taking at least 3 lectures in the morning, like before 12 o'clock. Before 12 p.m., I will be taking 3 lectures. And not tomorrow, I'm not sure about tomorrow, but in an upcoming future, because I have certain schedule. Okay, I have to reschedule my things. So now we will be left with this sensory system. Tomorrow we will be studying the sensory system. Okay, the sensory system in general. So download the book. If you do not have, I have shared the link, and you can like study it from there. Thank you so much, people. I'm ending today's class. Okay.